enforcement officers spend their lives serving and protecting others, but responding to difficult situations and seeing gruesome crimes every day can take a toll on their mental health.
KCBD News Channel 11's Natalie Falkenberry joins us in the studio with the growing mental concerns. Natalie?
Well, Karen and Abner, yesterday, a murder-suicide involving 2 children shocked the city of Lubbock. Unfortunately, incidents like this are what our officers see daily. I spoke with Dr. Andy Young with the Lubbock Police Department about the growing concern for law enforcement officers' mental health.
The officers see that 1% of society that most people don't believe exists.
Dr. Andy Young has worked with law enforcement agencies for 23 years as a counselor. He defines the field as rewarding but tolling, especially when it comes to mental health. He says one of the biggest challenges is getting officers to communicate after a gruesome incident.
You don't know where people are mentally and emotionally, and what affects one person doesn't necessarily affect another person.
Dr. Young says more often than not, officers are affected by cases that involve something or someone that they can relate to.
So if I have a child the same age as a child that is deceased, because I can identify that, then identify with that, I'm more likely to get anxious or depressed just because it feels like it's close to home and I start to worry about what might happen to my family.
That's why Dr. Young says it's so important for officers' loved ones to keep a close eye out for signs of uncharacteristic actions at home.
They might be a little withdrawn. They might be seemingly depressed because they're seeing, difficult things and trying to adjust to that. It would make sense that they are angry and frustrated because they have limited power to affect situations that, clearly need some sort of change and assistance.
Dr. Young tells us that after events like yesterday's, officers are contacted by multiple resources within the department in hopes to assist them and their families. Karen and Abner.